Hello student, today we will see treatment modalities for cancer. In my previous video, we saw surgeries, radiation therapy and chemotherapy. Today we will discuss about gene therapy and hormonal therapy. So what is gene therapy? Gene therapy means gene therapy is replaced in the place of damaged genes. Means the damaged destructed genes are removed and healthy genes are placed in that place. Gene therapy is insertion, alteration or removal of genes within individual cells in order to treat disease. I said every cell is made up by DNA and RNA. DNA contains millions of genes. So, it is a single cells. In a single cells, what gene mutation, gene damage is there? That damaged gene is taken out and a healthy gene is replaced. It is a technique for correcting defective genes which is responsible for disease development. But this therapy is still in an infancy stage. It's not much popular. Research and researcher as well as scientists are working on this. In coming days, sure it may be a popular. So at least if they ask, you should know little about this. So just go through this. Okay. Next, we will see hormonal therapy. So, what is hormonal therapy? Hormone used as a treatment to cure the cancer, especially the cancer cell which uses hormones as a food to grow, for their growth. Especially the reproductive organ, breast as well as a male prostate. Prostate will use androgen hormone and breast will use estrogen and progesterone hormone. So this hormonal therapy also called as a endocrine therapy. If they ask write about the endocrine therapy for 2 marks, don't get confused, same hormonal therapy only. See, hormones are used as a medication to treat cancer, especially the cancer which uses the hormones as a food for their growth, such as prostate and breast cancer and female reproductive organ. So, which uses hormone for their growth, through the hormone only destroying that cancer cells. Okay, now let me see what is the main goal or a hormone, how it works. So, these hormones will stop the growth of cancer cell or slow down the multiplication of cancer cell or shrink the growth of cancer cell. By shrinking, it reduces the complication of a cancer cell, and due to that at least the growth of the cancer cell may lead to obstruction or a severe pain. At least by shrinking, reducing all that symptoms. The type of hormone therapy given depend on type of cancer. If it is a prostate means androgen therapy. If it is a breast means estrogen and progesterone they will use. Okay, there are several different type of hormonal drugs are there. So you have to study it for the practical point of view. For the prostate cancer, they will use flutamide, Zoladex and stilbestrol. For the breast cancer, tamoxifen, put underline for this, Zoladex and letrozole. Now, let me see side effect of hormonal therapy. So, in male, there will be a nausea, vomiting, fatigue, tiredness, lethargy will be there. Erectile dysfunction means inability to have proper sex. Decreased sex drive means not feeling to have. Losing interest. In female also nausea, vomiting will be there, fatigue will be there, lethargy will be there. Apart from that, breast tenderness, pain, vaginal dryness, discharge, irritation, hot flash means entire body like a burn, like a burning like that, hot they feel. It is so much irritating to them. To tackle that, there will be some multivitamin tablets are there, okay, as well as some medications are there. Night sweat, severe night sweat will be there. Altered menstruation cycle, either they may get or they may not get, or they may get once in a 18 days, 21 days, 31 days, or a heavy bleeding, or there will be a no bleeding at all. Vaginal bleeding, and as I say, nausea, vomiting and all. So what are the nurses' responsibility? It is a great responsibility of the nurse, oncology nurse, to take care of the client, the one who is undergoing for any kind of a therapy, chemotherapy, radiation therapy, surgery or a hormone or any therapy, any treatment related to cancer. The first one is a assessing, history collection, physical examination, The later on educating, giving education, explaining about what is it and what treatment they are going to give and how it is benefiting to her and what are the side effects and how she has to cope for that side effect. Emotional support to client as well as an entire family member. So these are the responsibilities of the nurse. So now the last treatment modality, bone marrow transplantation, is a pending. That I will explain in a next video. So there I am going to finish oncology nursing. Next we will move on another unit. Thank you, student.